Okay. So let's look at the heart. The heart sits in a nice little nook in your chest, nestled right up between those two lungs right there. As you can see, it's specifically right behind the sternum, posterior to the sternum, anterior to the vertebra of the thoracic region, bounded on either side by the lungs. And it sits in a tiny little space in between all four of those structures called the mediastinum. Not a whole hell of a lot of space there, but it still works, still does its job. As you can kind of see, the apex is down here, and the base is up at the top. Okay, apex is down, base is up. You wouldn't expect that. You would think the base would be at the base, the bottom, but it's not. The base is orientated kind of superiorly and posteriorly. The apex is inferior. It actually comes in contact a little bit with the diaphragm right there via the fibrous pericardium. We'll talk about that here in a second. It is slightly rotated. And I mean, that's semantics. But really the big one here, it is kind of more to the left midline. Okay. Why is that important? Well, I mean, you want to listen to the heart, right, when the patient comes in. So if you know that it is slightly orientated towards the left, well, now we can do our APET monkey and listen to all the individual valves. Aortic, pulmonic, Erb's point, tricuspid, we can, the mitral valve, we can listen to them all. Just by knowing that this thing is slightly to the left. Okay. Behind the sternum. So don't put your stethoscope on a bone. Don't put it on a rib. Don't put it on a sternum. Something that we are going to see ad nauseum from here on out. The vast majority of all the organs in the body are going to be enclosed in connective tissue, wrapped in connective tissue. This compartmentalizes the structure. This separates the structure from the surrounding other structures within the spaces, within the cavities. So we're going to see a parietal whatever. We are going to see visceral layers of whatever from here on out. Okay. There's a couple exceptions, and we'll talk about those in the digestive system. But for the most part, everything's going to have a parietal layer. Everything's going to have a visceral layer. Okay. So these are just concepts that we're going to see from here on out in pretty much everything. When it comes to the heart, it has three layers, and they're collectively referred to as the pericardium. Peri means around, cardium means heart. These three layers include a very dense fibrous pericardium. Fibrous pericardium is really fantastic. It helps to anchor down the heart from just a few weeks after conception. You get a number of cells that kind of start beating in unison together, and then they don't stop. And they don't stop until you're dead. So this fibrous pericardium is helping to hold this heart in place within that mediastinum. And you can see a little bit of the white shadow right here. Okay, let me go this way. And here you can see that fibrous pericardium, excuse me, right there. You can see it all right there. Helps to anchor down the heart to the mediastinal space. It is dense, irregular connective tissue. As you jump around the heart's still pumping and beating and whatnot. So, I mean, it would make sense that this is going to be really dense in nature to kind of help really hold this thing in place as you go about your day. As you guys see, attaches to all this stuff. Something else it also does, it actually will give off some fibers that will go in and penetrate into the heart and give some stability to the various different parts of the heart itself, which is kind of interesting. But fibrous pericardium is there to help to anchor it and hold it down. That's the big thing that I would like you to know. As you can see, it also does something else, prevents the heart from overfilling. Just kind of underline that for now. We'll talk about that potentially a little bit later, go over that a little bit more. Overfilling of the heart can be a bad thing, and that can affect cardiac output, and we'll probably get to that more next week. The two major kind of other parts that we have here of this pericardium, besides the fibrous, is the parietal pericardium and the visceral pericardium. This book calls it the parietal layer of the serous pericardium and the visceral layer of the serous pericardium. So let's dissect these words. Okay. Whenever we see visceral, we see viscera, right? And that means organ. Around the heart, we've already established that. And what's a serous membrane do? Does anybody remember from way back in the first unit? Serous membrane, what does a serous membrane do?
Surround an organ or a cavity?
Well, yes, but what does it specifically do? What does a mucous membrane do?
It secretes serum, right?
The serous membrane?
Yes.
Yep, it secretes a serous fluid. What's serous fluid? Water. Okay. It is creating a watery fluid. Why do you think we would want a watery fluid here?
To provide cushion for the heart.
Yeah, I mean, there's a little bit there, but I mean, it's sandwiched in between your lungs. So, I mean, the lungs are just big old sponges, basically. So, doesn't that provide a little bit of it? What else? I mean, it does a little bit, but what else do you think?
Does it give it buoyancy?
Water does provide buoyancy, but not a big thing. Not a big thing here. That's more just the brain. I want all of you to put your hands together and go Mr. Miyagi on it. If you don't know what the hell I'm talking about, you are way too young for me. Rub your hands together really hard, really fast. Keep going. Do it. Faster.
To decrease friction.
There you go. It decreases friction. We are going to see serous type membranes around all of these things. Now, think about this now. The heart is beating all the time, and it's sandwiched, it's squished in this tiny little space here, right? So what are we going to produce every time? We're going to produce a little bit of friction every time. So that water is going to provide a little bit of reduction of friction every single time. So it's basically like a little lubricant. And we're going to see this phenomena everywhere. And just, I mean, that now that we say it out loud, it makes a hell of a lot of sense, right? As you sit there and you're sitting down and you're at your desk and you're writing away right now, all of those organs, I mean, you have like 9 feet of of various different intestines. You're not 9 feet tall, man, right? At least I don't think so. I mean, I've never seen any of you stand up, so I don't know, maybe you are. But that fluid allows us to reduce friction. It allows these organs to kind of ooze over one another, for lack of a better word, right? So this serous fluid, this understanding what a serous membrane is going to be an important concept that I hope you remember, well, especially now. But this visceral layer, or this visceral pericardium, it is usually referred to. This is the first time I've seen it listed as this way. It is directly on the heart. Okay, and if we go up here, here is this visceral pericardium. It's just this outermost portion of this serous pericardium. As you can kind of see, it has another name, the epicardium. We'll talk about the different layers of the heart here in just a little bit. But you can see this is a piece of connective tissue that is right on top of the heart. Okay. And it is very difficult. I'm looking at a heart. I'm going to try to dissect this sucker. Not this weekend. I'm going to try to get my boys to do it with me, see if I can freak them out. But as you look at this heart, and I'll show you guys next week. I'm a hot mess today. But when you look at this thing, I mean, there is a little bit of fibrous material here, but it's hard. It is so hard to see the difference between the visceral layer of the pericardium and that outermost layer of muscle, the epicardium. So they're usually referred to both synonymously. When you're talking about the visceral layer of the serous pericardium, most people talk about the outermost layer of the heart, and that's the epicardium. So that's why you see that listed underneath it. But this this visceral layer of the serous pericardium is all around this heart. Wherever the heart is, there it is. Okay. Comes up there and then folds on itself, and now it lines that cavity, lines that mediastinal space. And here you can see that up here. Here's the visceral layer, and it folds on itself, and now it lines the cavity. And that's the parietal layer. Okay. Okay. Parietal layer is always going to line the cavity. We are going to see parietal layers. We are going to see visceral layers from here on out in pretty much every single system. Parietal layer is always going to line the cavity. Visceral layer is always going to line the organ itself. And then we have a tiny, 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 tiny little space in between these two layers, ingeniously called the pericardial space or pericardial cavity, filled with, serous fluid. If the heart inflames, then it invades that tiny little space, that tiny little cavity there. And now when that heart contracts, it's going to be super painful. And you can hear that with the stethoscope. Okay. Sometimes it's referred to as the pericardial sac. And when you get out and around outside of a classroom, that's pretty much what they call it. But the pericardial sac is the fibrous pericardium. It is the parietal layer of the serous pericardium. It is that pericardial fluid within it. Okay. But I want you to know all the specifics, all the individual pieces, because I like detail. If for whatever reason the heart becomes inflamed and irritated, it doesn't take long for that pericardial sac to become swollen and irritated as well. And that's what pericarditis is. Peri, around, carditis, the heart. It's inflammation of the sac around the heart, caused by a number of different things. I'm not going to ask. But you get a fluid accumulation, like I just mentioned there within that pericardial cavity. Really, the space, as the heart enlarges, it invades that space a little bit, but it produces a lot more fluid. And I don't really have a whole heck of a lot of space. Okay. I don't have a whole heck of a lot of space for expansion here, for swelling that occurs when infection happens or disease happens. And, as a foreshadowing, I can't overfill very much either because there's not a whole heck of a lot of space. Not a lot of space going forward. I got the bone. Not a lot of space on either side. I've got the dang lungs. So if it overfills too much or swells up too much, obviously that can affect my ability to inflate my lungs. I ain't going backwards. Well, I can, but I'm going to start compressing the esophagus, the thoracic aorta, the azygos veins. I'm going to start screwing around with anatomy here. So it doesn't, that fibrous pericardium really helps to anchor and hold this thing down and prevent a lot of that stuff. But with pericarditis, I get that excessive amount of swelling, and now this heart can't really expand and contract very well. So the heart is not an effective pumper. And it's going to be told to by the brainstem to start pumping harder and faster, and it's not going to be able to do it. And it just causes some extreme pressure within the heart, and that's cardiac tamponade, a serious medical condition. Too much pressure in the heart. But before it gets to that excessive extreme, I hope to God this person has come into the doctor. They're going to come in because it's going to be difficult to breathe. Okay. Just because some of that swelling, the heart, you feel like your heart's just working harder. You're going to have some swelling occurring there. So there's going to be a little bit of backup going on. And you'll hear that. You'll hear that cracking sound. It's like high grit sandpaper when you listen to it. And you just put that little stethoscope on the back and you'll hear it. You'll just hear it. It's weird. It's kind of freaky to hear it. But that friction rub is a classic sign of pericarditis.